Channel 114. Channel 114.
This evening on the VC3 News Update, Prime Minister Dr. Honorable Ralph Gonsalves is emphatic towards families who have lost relatives to dengue fever. Low-level moisture and instability expected across St. Vincent and the Grenadines early Thursday morning ahead of a tropical wave. And Australia's Prime Minister Scott Morrison conveys warmest wishes to the government and the people of SPG as the nation prepares to celebrate its 41st anniversary of independence.
And in sports, Top Camden Park defeated Great House 2-1 yesterday at the Camden Park playing field. And in the Caribbean South Leeward Intervillage Freedom Cup Challenge, Plan Reload and Lager Height face off today. And in regional sports, all-rounder Jason Holder will be retained as the West Indies Test captain for the tour of New Zealand.
We'll have these stories and more at 7 p.m. on the VC3 News Update.
This week we are talking COVID-19 and dengue, which has descended on us somewhat. With us this evening to talk, the Chief Medical Officer, Dr. Simone Keizer Beache, and Medical Officer of Health, Dr. Roger Duncan. Welcome, guys. Glad to have you back here with me on the show.
Thank you, Teresa.
Thanks for having us.
So we are in the midst of COVID-19, trying to manage this pandemic, and dengue has appeared on our doorsteps. Mm-hmm. As a matter of fact, we have had some deaths and there has been quite a lot of concern. What is the status now? Let's start with dengue. What exactly is the status as of today?
Okay, so yes, we have been dealing with dengue over the last few months, and as of yesterday, we had 655 cases, laboratory confirmed cases of dengue in St. Vincent and the Grenadines. And as we know, those are just the persons who we did tests on. But for each one of those persons, you might have between 3 and 4 additional persons meeting the clinical diagnosis criteria for dengue. So 655 laboratory confirmed cases. 6 deaths, unfortunately. Just today I was relooking the actual death certificate of one of those persons, and we might have to do a reclassification because that person, though they had dengue, the cause of death was not related to the dengue. So we might actually have to revise that figure down to 5. So we have had those persons have died. We are still seeing significant numbers of persons seeking care, and we are happy that persons are, following our recommendations in terms of seeking care early. And for September, however, we noted that the last week of September at the emergency department, we had a slight decrease in the numbers. But when we looked at the other clinics, and hospitals, their numbers were going up. So we think what might be happening is that persons are utilizing the other facilities rather than the numbers actually going down. Though the laboratory confirmed cases for the last week also went down a bit. So we're looking. We're seeing what's happening.
Oh, so a possible 5 deaths. As you mentioned, we might have to review one particular case. But do these 5 deaths have anything in common? Is there any common denominator per se?
We had some of them had pre-existing conditions, so meaning that they had other illnesses which made them more vulnerable to the effects of dengue, to severe dengue. We also had situations where the presentation, meaning when they try to get care, might have been late in the process. So we have some persons who went to get medical care around day 5, day 6, and we know that around day 4 typically is when, if you're going to have a bad outcome, that's when it happens. So that if you were to present on day 5 or day 6, the likelihood of being in severe dengue, because you have classifications, the likelihood of being in the state of severe dengue fever is greater. So hence our push for persons to seek care early, maintain your fluids, follow up as advised, because those are the two things. Persons with pre-existing conditions that made them vulnerable, and persons who presented a little later in their illness.
So it's incumbent that people seek care early.
Extremely important. I know lots of persons might be hesitant because they anticipate that the wait is going to be long. But we're still encouraging persons to utilize all of our more than 49 healthcare facilities. Nurses are there, trained and competent enough, even if the doctor is not there on that particular day. The nurse is there, and that nurse is highly trained and can manage and can assess whether or not this person, initiate treatment and determine whether or not this person needs to be referred for even more care. So we really emphasize seek care early and follow the recommendations. We have had some instances where persons have been reluctant to have their dengue test done. Not sure why that would happen. So some people have been reluctant. Some people have been reluctant to come back for review because their initial visit was very long. And so they, I feel a little better, I don't feel too much worse, so I'm not going to come in. We really want you, if you've been advised to follow up, please follow up. If you've been advised to not use ibuprofen, which is what we have been saying from the beginning, you don't use the NSAIDs because of the possible complications. Use what is advised. Your acetaminophen, which is paracetamol. Use your pawpaw leaf extract. And lots of fluids. And if at any point you are vomiting, diarrhea, you can't keep your fluids in, that's a warning sign. You need to get to a healthcare provider.
Let's talk a bit about some of the warning signs that should get people worrying and get to a healthcare provider.
So Simone pointed out that one of the first things, that if you're vomiting persistently, you're unable to keep your fluids down, you can't eat. So vomiting, persistent vomiting, abdominal pain, if you have any nosebleed or you go to the bathroom, for males if you're urinating, your urine turns a little brownish, or for women if you wipe and you see blood, these are warning signs. But particularly the earlier ones that come first, the two that come first is abdominal pain with persistent vomiting. Once you have those, you really should immediately seek medical care.
How would you say the health facilities throughout St. Vincent and the Grenadines have been coping with the dengue situation?
Well, I think it's been quite difficult. I mean, our staff is not finite, and neither our supplies too. So staff has been going, non-stop from morning till evening, lots of cases, fever, joint pains, vomiting, diarrhea. So what what we had to do in some instances was to shift activities. So if this today was supposed to be this sort of particular clinic activity, then we had to change that because we have sick people to look after, and we have to be able to do that. And then we have to reorganize our supplies and with IV fluids, make sure we have fever-reducing medication, make sure we have those. Of course, at the end of the day, you end up with a very tired and frustrated workforce because it's hard. I mean, doctors saying that I've been going since morning. It's really hard. I'm tired. Nurses are saying the same thing, and and that's what the staff is. We try our best, to encourage to shift. So if there's a clinic, for instance, that has low activity, we'd probably want to move personnel from that clinic to some area where there's high activity to sort of balance off to allow people to get some rest. But it has been extremely challenging.
Do the symptoms for dengue mimic COVID-19 in any way?
Let me take that. They can early on. I mean, the thing about what we're realizing more and more about COVID is that COVID has many vague sometimes symptoms. So you might get a cough. Dengue, typically, you don't have a cough. You might have a fever, a low-grade fever with COVID, whereas dengue tends to be a much higher fever. You might get tiredness, more with the COVID. The tiredness, the fatigue, the weakness. Dengue more is dizziness. That is because of the dehydration. So there are those similarities, but there can still be a differentiation if you really go into the history and you really focus in on the fever, the pattern of the fever, the presence or absence of a cough, a rash. COVID typically doesn't have the rash that dengue has. The COVID rash is more of a rash of the palms and the feet. So the symptoms are not that similar. What we will be more looking out for with the dengue would be Zika, chikungunya, which we haven't found, and the other viral illnesses which can present with a fever and a rash.
But it's important Simone mentions, the question that you asked is important regarding dengue and SARS-CoV-2. But we've been doing a lot of rapid testing though for people with dengue to check whether or not they have COVID-19 antibodies. We haven't found any.
No.
So we haven't found any correlation between the current incidence of dengue fever and COVID-19. But we have been looking. And we will continue to look because that's the nature of COVID-19, as Simone says. It's it has many faces. It could present in many different ways. I think quite a bit of it which we still yet to understand.
Mm-hmm.
So I am wondering if that you did in fact mention that some people have been reluctant to take the test for dengue. So I'm wondering if there's any relation there, if people are afraid to take the test because they might think or suspect that they have. I don't know.
I don't know either. I mean, I really why you might not want to know, but then maybe persons have maybe it's a fear. I think they're afraid to know because of what that might mean. Some persons might feel that if I'm dengue, they're going to keep me, they're going to do this, but we are testing. Once you come into the emergency department at Amidst, we do test you for both. And we also will do the PCRs, especially in those very ill persons. We do the PCR for dengue, we're doing PCR for dengue and for COVID, right? So we are testing, and we are doing the antibodies for dengue and the antigen, and I mean the testing is wide. We are also testing for other. So whenever we send off, we test for the CHIKV and the Zika, and then we might do other viral studies.
Okay, we'll be back in just a moment.
Dengue is a flu-like illness spread by the bite of an Aedes mosquito infected with the dengue virus. The Aedes mosquito can breed even in a small amount of water accumulated in any container-like object. Severe headache, pain behind the eyes, nausea and vomiting, high fever with 2 or more of the following symptoms: severe muscle and joint pain, a rash on the skin. Consult a doctor and do as advised. If advised hospital admission, do so immediately. If advised home-based care, take plenty of fluids, nutritious food and paracetamol for fever and pain. Prevent mosquito breeding and protect against mosquito bites. There is no treatment for dengue, but dengue can be prevented.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes: $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpot. There's cash to catch with just a scratch.
Welcome back. One of the things we do know is the fact that there are several strains of dengue. So which strain or strains are most prevalent in St. Vincent and the Grenadines? Which one is affecting us most?
So right now we have number 3. Type 3 dengue is circulating right now in this current outbreak. The last outbreak we had in 2010 was 1 and 2. And prior to that, last outbreak was 2010 and 2012, 1 and 2. And prior to that, between 2000 and 2008 was 3. So we have had 3, then 1 and 2, and now we're back to 3.
What is the difference between the various strains?
Well, it's primarily the antigenic makeup, the protein coating around the virus that deals with. But what is more important, though, is that if you've been exposed to one strain and you have immunity to that specific strain. So immunity is strain specific. But then if you encounter a new strain, the likelihood of you having severe disease increases because you seem to have some sort of super immune response that would trigger all of these not so pleasant things and bad outcomes. So when you have 3 appearing now to what we describe as pretty much a virgin population who's not being exposed to 3. So you have very little herd immunity in the population, so that doesn't really help with the spread. But most people have not encountered type 3 dengue, so then the incidence is bound to be high.
Okay, so if I've had 1 or 2, it doesn't mean that I won't get the others.
Oh no,
You could get the others.
You could get the others.
Can get the others.
Yeah.
So that's the thing, as what you would say, the immunity. So if you get 1, dengue type 1, that strain, you get immunity to that strain. But you can still get 2, 3, and 4. So if you end up with, apparently what happens, from what Dr. Thompson was saying, is that you have 1, and the body develops immunity to that 1, but it also develops what is a non-neutralizing antibody, which coats the 1, which would coat the 1, and the body would then, this antibody, when you're presented with a new one, recognizes it as similar, coats the virus, and actually protects the virus, something like that, and allows the virus to replicate. So it makes you more susceptible to a different strain, and your response is can be the immune response can be extremely powerful or aggressive, and so you have what we call the cytokine storm, a lot of inflammatory responses. So the whole body is fighting this, is responding to what is normally a lot of virus particles, a lot of virus being produced, and so that you get the bleeding and the vomiting, and the kidneys can be affected, the liver can be affected, so you get hepatorenal damage, and then that can lead to severe dengue. You can have bleeding, dengue hemorrhagic fever, and death.
So have we had more severe cases as opposed to mild cases so far?
Well, we have had, the last dengue outbreak we had one death. And this time around, where we have 5, probably 6, but 5 deaths, it is severe. We are seeing a lot of cases, however, and if we were to look at the numbers we are seeing, so I had mentioned some time ago that on one day, one clinic saw 100 persons, and the majority of those persons were persons coming in with symptoms of dengue. So right now we are actually getting the figures for the clinical diagnosis one. So as I said, we have this big figure of 655 laboratory cases, but we are getting the figures now for those persons who didn't necessarily have a blood test, but from their symptoms and signs, we have made a diagnosis of dengue, so that we'll be able to see what proportion of the persons have had so bad an illness that you needed admission and that you became very ill. But we are very concerned about the proportion of persons who have needed admission and in persons who have gotten very ill. So we definitely have a significant outbreak, and we are concerned, extremely concerned about the importance of aggressive management, early management, to prevent any further suffering, these difficult admissions and where people get so ill.
The age group most affected thus far?
So we're still around the age group of, as we had said, under 15. If we look at our statistics as of week, we have been seeing 69.47% of our patients in the under 25 and 52.98 in the under 15. So it is very much a disease of the younger age group, teenagers, young adults.
Why?
That's what. Because as Roger was saying just now, so we have had type 3, but you have between 2010 and now, in that 10 years. 10 years. So anybody born between after 2010 might have been exposed to type 1, type 2, might have. So, and now we have type 3. So there's a possibility that those persons who might be 10 years old, 8, might be having that response because they're now being exposed to a type 3, and you have that excessive antibody response, this viremia. So that's one thought. The other thought is that you might have a population that wasn't exposed at all, and now they are being exposed to this virus, and they're having this extreme response. So there are two groups out there: the ones who have no exposure and they're now getting dengue, and so they're responding, or they have had one type of dengue, they're now being exposed to another type, and you have that reaction because you have been exposed to 2 types.
So there's dengue, there's Zika, and there's chikungunya. So all 3, it is possible that all 3 may well be in the air at this time?
It is possible. We have endemic chikungunya and endemic Zika, but in all of the testing we have done, we haven't picked up any chikungunya or any Zika. But again, remember, we are not testing everyone. Okay, we're not testing everyone. But the symptoms are not. The chikungunya and the Zika, the chikungunya especially, the severe
pain,
body aches, and so we're not getting that. And the Zika, we're not. No.
Mild low-grade fever
yeah,
and prominent ration.
Right. No.
So there are different symptoms for all.
There are different symptoms, but it's very difficult, to rely on the symptom the symptoms alone to differentiate.
Yeah.
And I mean, we do the surveillance for these fevers under what we call fever undifferentiated, meaning that you just have fever, we're not sure. And so when the testing is done, we do Zika, we do lepto, also as well as chikungunya, as well as the dengue.
H1N1.
And H1N1.
Okay. What should we do to prevent dengue? What are some of the things? Health is a shared responsibility. What should we do?
Well, I mean, the obvious answer is to avoid the mosquito bite, yeah? But that becomes a little challenging when you have plenty of mosquitoes flying around. So the deeper answer is to have source reduction. So we know what the vector is, and if we reduce the vector, or if we try our best to keep the vector under control, that's probably the best thing we could ever do. I mean, we've been doing lots of other things, and Simone will speak about these, and I think it's probably one of the things that we've been working on over the last couple of years, and we're still working on it, is how do we mobilize communities, to come to action for health. And it's probably one of the things we've not been talking about loudly enough, I believe. We've been trying to build sustainable community health groups in communities where, I mean, the model is this. We come to you and we give you a profile of your community. We say that these are the critical health issues in your community. Is it diabetes? Is it cancer? Is it water quality, food safety issues, vector control issues? And we tell you, these are things that are affecting you. Why they're affecting you, this is why, and how they're affecting you. We give you some numbers, as much stats as we have. And we ask you in the community, so look, what it is you want to do, what things you consider to be priority, and what things you think lend themselves more to interventions. And I think we need to do much more of this. And I mean, some communities have been mobilized within in response to the outbreak over the last couple of weeks. How do we make this sustainable now? Then this is the issue, and how do we have active, progressive, sustainable social participation in health? And that's what we're aiming for. We never thought for a moment that we could take care of the mosquito problem throughout the entire country, because it's just humanly impossible. And if we were to do that, it's been exercise in folly. We're probably fooling ourselves more than anything else. And so we need communities to be empowered, and we have the information. We'll give the information, and we'll allow you to make the decisions as to how you're going to respond to it. And this is something we've embarked on over the last 2 years, I believe, and we would continue to do that.
Are there any particular communities that are more affected than any other? Well,
the data seems to indicate that people who live in the Pembroke Health District are more affected compared to other communities. Again, we need to take this with some, right, because it's predominantly a biting mosquito. So even if you live in Pembroke, you probably might be working in town for most of your working hours, or working somewhere else, or you're a farmer somewhere else. So that, we still have to take that. But predominantly, most people who have come down with dengue from the Pembroke Health District.
Okay, well, when we come back, we will talk a little bit about managing COVID while managing the dengue outbreak. And just a reminder that you can send your questions, comments, and concerns, and the panelists will be pleased to respond. We'll be back in just a moment.
Channel 114.
evening on the VC3 News Update, Prime Minister Dr. Honorable Beache is emphatic towards families who have lost relatives to dengue fever. Low-level moisture and instability expected across St. Vincent and the Grenadines early Thursday morning ahead of a tropical wave. And Australia's Prime Minister Scott Morrison conveys warmest wishes to the government and the people of SPG as the nation prepares to celebrate its 41st anniversary of independence.
And in sports, Top Camden Park defeated Great House 2-1 yesterday at the Camden Park playing field. And in the Caribbean South Leeward Intervillage Freedom Cup Challenge, Plan Reload and Lager Height face off today. And in regional sports, all-rounder Jason Holder will be retained as the West Indies Test captain for the tour of New Zealand.
We'll have these stories and more at 7 p.m. on the VC3 News Update.
Welcome back. What are some of the things that will be happening as we try to manage this dengue emergency? What are some of the things that are planned for implementation in the immediate future?
So as Dr. Duncan said earlier, the importance of getting communities mobilized in this shared responsibility is paramount. And tomorrow, there will be a meeting of community groups, established community groups, whether they're disaster groups from the different districts, the Red Cross groups, or the volunteer groups. They'll meet tomorrow at the Methodist Church Hall, and it would be to, inform, decide how they're going to roll out, how we are going to be supported. So that's something we are really looking forward to, because that's key. We might fog, but that is just going to kill the adult mosquito. We need to get to not producing, not breeding the mosquito, and that's going to require that everybody takes care of their home and their surroundings. So that's a major part of it. At the same time, we'll be informing persons. This mobilization will allow for informing persons not just on source reduction, but general health, what to look out for, how to manage. That's what we're moving on in terms of mobilization.
Community mobilization.
Community mobilization.
Doctor, how has it been going with COVID? I mean, I suspect that it's a bit challenging having to deal with both emergencies right now. What is the status in respect of our management of COVID?
Well, for COVID, we continue to all the cases we've had, they're not active cases currently, but everything we've had either been imported or related to an imported case. So we've been focusing on our port health, our points of entry, to make sure we try as much to make sure, while not interrupting people's travel, people's going and coming, but to make sure that we have a good handle on who's coming, where they're coming from, what they have and what they might not have. So we've been very aggressive in the testing as well as in the quarantining. But then the same people who are doing this COVID work are the same people who need to respond to the dengue outbreak. And again, it's really challenging. I must say the staff, there have been complaints, and unreasonably so. I don't think the complaints are unreasonable, but they've been going. They've been still going. We've been able through it somehow to give people a little, 5 days off, 10 days off, so that you could, recuperate a little bit, spend time with your families, and readjust to some sort of normalcy. But it's been challenging, and we've been continuing to try.
So a day in the life of the staff pre-COVID-19.
Well, I don't know, when the day starts. Let's say, we begin, you could have anything. So you could wake up to a message from the hotline that you have somebody with X, so-and-so, who's called for these. Then you have to now engage this person on telephone to see what it is, to make some sort of assessment and decide what action could be taken. And then, you know, there are the telephone calls to somebody else to say, well, look, we have this problem. It needs to be checked. So could you do this at 6 o'clock in the morning? And so you're either collecting samples, interviewing people, or, you know, trying to figure out what's happening. Or you're at the airport screening people who are coming in. I mean, and that's challenging. I mean, you thought it would have been pretty simple. The protocols are clear and unambiguous. In my mind, we've always published the protocols. The protocols are available on the website. But still, there's quite a lot of people who turn up, surprisingly Vincentians. Non-Vincentians pretty much know what the protocols are.
I noticed that you've been having some challenges there. I mean, people have actually been taken to court within recent times. So how has that been going? And why are we still having this kind of problem? Why is it people are still coming? You've been told beforehand that this is what you need to do, but yet you come home and...
Yeah, and I think that people come to, as I said this a couple of months ago, I think, in the program, people come to defy and probably to show you that, you know, really, you know, your protocols really don't mean anything to us. I mean, taking people to court is tedious. You have to sit down and prepare the reports. While you're preparing the reports, there's something else that needs to be done that's probably doesn't get done, or you have to send that task to some already overburdened person to try and get that done, and then you have to appear in court and you have to spend the time there and so forth. So it's not a course of action that we, you know, would really like to use, but we're left with no choice. I mean, people coming and refuse to spend a single day in quarantine. They make a commitment and say, okay, fine, I understand, okay, fine, so I'm supposed to go to this place to stay. This is the hotel which I'm going, and then they go or don't turn up there, they disappear, they go somewhere else, you can't find them, you're calling them, they're not answering. Then you have to have the police at, you know, all over the night trying to track people down and trying to find them. And a lot of these, the police officers we use most of the time are special branch people I mean, their skills should be used for other things somewhere else and not for this, and not for this. And they have to spend all these hours in the night trying to track people down. And when you track them down, they have all sorts of stories and all sorts of things. So, I mean, we had no choice than to resort to the court to say, look, you know, this has to stop. This really cannot continue, and somebody has to take responsibility for this. We've asked people to do, I think the simplest of things we've asked people to do before you come. There's a simple form online. Please complete it for us. If you complete that for us, you're waiting in that line to be screened. We're going to take no more than 5 to 7 minutes to screen you and get you on your way to immigration. If you don't complete it, then we're going to take 15 to 20 minutes to have this form completed. I mean, you booked your ticket. I'm sure you knew when you were coming. I mean, sit down at home and, you know, take 15 minutes, complete it for us so that when you come, we just simply need to verify some stuff and we send you on your way. You know, because we don't want to delay you in any way at all, because that doesn't help us. Because, you know, you've been flying for hours, you're tired, you know. We've been there for hours too, and we've been going since March. So nobody wants this, so please do that. We say you must come with a reservation. Please try. If you're coming from a high-risk country, please come with a reservation, you know. Don't come there now and suddenly say, I'm not going to any hotel, I don't have any money, nobody can make me go, and that sort of thing. And please don't do that. It doesn't help you, it doesn't help us, it doesn't help the country, you know. And when you do decide to go to a hotel, please comply, you know.
So that's a question I need to ask. So you arrive and you are allowed to go to the hotel on your own?
Well, not on your own. You have designated taxis to take you. So these taxi drivers have been trained in infection prevention and control, so they know exactly what to do, you know, wear masks, where the passengers should sit, how much passengers they should carry in their vehicles, and so forth. So you go there to the hotel. People, you know, tend to disappear, and there are people who, you know, you go to a hotel and you start cussing the receptionist or something, and I mean, he or she is not going to really stand in your way, and, you know, they're going to give you room and, you know, allow you to, people have packed their bags and left. I'm not staying here, I don't want to be here, and this is, you know, and this is not good, I don't have anything, I've been tested, and this is, you know, what it is, you know. We see what happened in Barbados regarding the recent cluster cases they had. St. Lucia's today announced that they have another case from an arriving passenger. And when we look outside of us in terms of what's happening, the numbers are growing. I mean, it's the numbers are growing. So I am pretty certain that the next couple of weeks, we're going to get a case or two. We're going to get something. And then our responsibility is to be able to early detect and isolate. If we're able to do that, then contact tracing becomes minimal. If we can detect early, and if we don't get to isolate, contact tracing becomes a nightmare. And actually trying to find people who might have been exposed to a particular case becomes extremely difficult. And that is why we say, look, you're coming from high risk, please spend these 5 nights in a facility. Why? Because we want to make sure, we know where you are. 2, you're in some sort of isolation. And thirdly, we could get to test you again. So we test you when you arrive, and we test you again on day 4 and day 5 to see exactly where you are. And people just need to comply with that. And if they do, it would really help us all.
Okay, so someone is asking, hello, I am coming from Canada. Do I need to go to a hotel? And if so, how long would I be staying at the hotel for?
All right, so today, if you're coming from Canada, and people must remember that the protocols are very fluid. They're trained, so you have to keep checking and checking. So if you're coming from Canada today, Canada is considered medium risk, which means you must arrive with a negative PCR test that's been done within the last 7 days. You will be tested upon arrival, and you will go home to begin some isolation until you know the status of everyone who came on that flight with you. Okay, and that usually takes us about 2 to 3 days. So you go, you stay put until we call you between 2 and 3 days to say, well, we've cleared the flight, everybody is fine, so you're free to move around. Of course, we still advise you to be cautious, wear your mask, practice social distancing, and practice proper hand hygiene.
And that's for Canada. The US
That's for Canada.
is a totally different protocol.
The US is a totally different protocol. The US is considered high risk. There's active transmission of COVID-19 in the United States of America. So if you're coming from the US, well, complete the form first, please. That would help. Okay? Come with a negative test that's been done in the last 5 days. Okay? All right? You'll be tested on arrival, and you'll immediately go into your hotel and Tourism Association approved quarantine facility for 5 nights, and we'll test you. I retest you again either on day 4 or 5, and after that you go home for the other 9 days to complete your quarantine.
So everybody is tested on arrival.
Everybody is tested on arrival. We try our best to test everybody who come into the country.
And it doesn't matter where you're coming from.
Doesn't matter where you're coming from. I mean, there's the conversation with the CARICOM bubble, which we've activated in part, and currently it's only Barbados that people coming from Barbados we may allow to enter without having a test. But bear in mind, we have port health officers, and they have the final say and discretion as to what happens, what sort of screening takes place when you arrive. Yeah? And they could, for instance, depending on what risk they perceive or understand, they could change. If you're coming from Canada, for instance, you probably might be asked to go into a hotel for quarantine because if there's a particular risk that they think exists, and we need some time to sort it out.
Okay, so it's no hard and fast rule where that is concerned?
It's not hard and fast. More often than not, the protocol is followed by my hotel staff. But if they perceive any risk, or, if we think that, for instance, you land on a flight and there was somebody who's obviously sick on that flight, we don't know what they're ill with. Okay, until we sort that out, we're going to ask you to stay put.
Okay, we'll be back in a short moment.
This evening on the VC3 News Update, Prime Minister Dr. Honorable Beache is emphatic towards families who have lost relatives to dengue fever. Low-level moisture and instability expected across St. Vincent and the Grenadines early Thursday morning ahead of a tropical wave. And Australia's Prime Minister Scott Morrison conveys warmest wishes to the government and the people of SPG as the nation prepares to celebrate its 41st anniversary of independence.
And in sports, Top Camden Park defeated Great House 2-1 yesterday at the Camden Park playing field. And in the Caribbean South Leeward Intervillage Freedom Cup Challenge, Plan Reload and Lager Height face off today. And in regional sports, all-rounder Jason Holder will be retained as the West Indies Test captain for the tour of New Zealand.
We'll have these stories and more at 7 p.m. on the VC3 News Update.
Welcome back. This is our final segment for this evening. We seem to have had a sort of lull in terms of cases, and people seem to have gotten relaxed, and as though we've thrown all protocols out of the window. Tell us about the need for Vincentians to remember that the in-country protocols are in fact still in effect.
Okay, so right now we have no active cases of COVID-19 in St. Vincent, no recorded active cases. And that's because of the strict protocols that we have in place in terms of persons entering that Dr. Duncan just detailed. All around us, again, as Dr. Duncan referred to, we notice in the US, in New York, I think they closed some schools in some boroughs because they're noticing some increased numbers for COVID. Canada is going up to. The UK has gone up to high risk in our protocols from medium, they've gone up to high risk. France, Germany. So we are seeing increasing numbers all from our source areas all around us. And even though we have no active cases, the need for us to be extremely cautious and to maintain, and in some cases, increase the security, what we have in place to protect us, it exists. And in country, we want persons to remember that COVID is still around. It's not gone. It's not A&D. We haven't finished. Sometimes I heard if we managed the COVID pandemic, or when we had COVID, it's not finished. It's still very much there. It's anticipated that we'll be dealing with COVID up until 2021, 22, before things come back to a normal. And so we're urging persons to still be mindful, Persons are coming in to visit you. Did I get a cough a few days after somebody was there? That could still be, We need to still be alert. We're not getting that many calls about COVID cases anymore. Persons need to be alert. We want you to still use your mask. You seldom see a mask. I think I'm the only person who might be in a mask sometimes when I go into a pharmacy or something. Wash hands, distance when possible. Be alert to the symptoms. COVID is around. We have no active cases. We are doing massive screening, and we are testing everybody who comes in, but all around us, there is active COVID disease, which is increasing. And so we really want persons to be very aware that this isn't over.
Roger?
Well, Simone is absolutely correct, because and the golden rules are the same thing. The best way to avoid COVID, avoid mass gatherings, don't go where it's crowded. If you go in a space that's crowded, make sure you wear some sort of face covering to protect yourself. Keep your hands clean. I know it's difficult to don't touch yourself often, but, please try to keep your hands out your face, out your eyes, and out your nose. And you just follow these. Encourage the people around you to do the same. If you go in a public space and there are people trying to crowd you, you make sure you tell them to please keep your distance. Keep your 3 feet or 6 feet away from me, and try your best to encourage this sort of behavior. It has to become learned, and I think that's the only way we're going to, help to protect ourselves. We never said that there's not going to be a case of COVID-19 in St. Vincent. We never said that there doesn't exist the possibility at all of local spread or anything. We never said that. We said that we're trying our best to make sure that we could able to detect, isolate, and contact trace, and that's what we've promised to do. And we need you to help us in doing this. I mean, like, if you go out to a restaurant, we're not saying that, you need to write down the name of every person that comes to the restaurant, but, Teresa comes in with her group, you need Teresa's name, number, and telephone number. If something's happened, then at least Teresa knows who were in her party, and these people could be easily traced, that you could figure this out. We asked the business people to try to do this as much as you could, to make sure. But, let us try and take this seriously. It's not gone anywhere. It's not likely to go anywhere, as Simone has indicated. And even if we do get a vaccine by, 21 or 22, I mean, how widely available it is going to be, what the cost implication is going to be, and how well is it going to work. So we still have to go back to the good old-fashioned things, yeah? Social distancing, clean hands, and stay home.
Can't go wrong.
No.
We sort of glossed over the fact that the protocols for the bubble rather, has burst somewhat.
Sorry.
So I know about sometime last month it was.
The 18th.
Yes. We could enter certain countries, neighboring countries, without...
That was the CARICOM bubble. Under the CARICOM bubble, certain countries were identified according to their the low activity, low incidence of COVID-19 to be countries in the CARICOM bubble, which meant that you could enter those countries without having a PCR and you would not be quarantined. That was the official statement. This is what was recommended by CARICOM. Along with that, no tests, no quarantine, the countries also had to have in place certain measures, certain protocols for dealing with persons coming from high-risk areas, which would then decrease their own internal risk. And what was found, the actual fact is that only Barbados and St. Vincent at that time, on the 18th of September, went ahead with this recognizing a bubble. Many of the other countries, so for example, if you go to St. Lucia, you have to come, even if you're coming from St. Vincent and we're in the bubble, St. Lucia's in the bubble, the CARICOM bubble, you have to come with a negative PCR test. And this was something that there was, you had discrepancies. You didn't have, the bubble wasn't, some places did not implement, did not start. Grenada apparently started, but there was no wide acknowledgement of that. And so because of that uncertainty as to the compliance with all of the other requirements for the bubble, we decided to continue testing persons. Even if some persons came without a test, we decided to continue testing persons who would come in just to make sure. And then at the end of September, we decided that this wasn't working because if a Vincentian went somewhere, they might still require. And we decided then just to limit the activated bubble to Barbados. So if you're coming from Barbados, we're not asking you to bring a test. We might still test you, but everybody else is required to come with a negative PCR. So the bubble is probably has different compartments. It's a lock you. What's that?
It got a needle.
So, but I think the aim is every island, they need to be comfortable. They know what their procedures are like, and we have established a system here, and we are not going to risk the safety. And if that means that we do extra testing when somebody comes in, and that means we ask you to quarantine for 24 hours until we get a test result, that's what we will do.
So 24 hours is fine because we're pretty good at testing. We're really good. I mean, we don't like to say publicly, well, to saying you could get the test back in 24 hours because the colleagues in the lab would say, oh, you can't go tell the people that. People want the test back in 24 hours. But we're pretty good. We don't delay in the testing. So your quarantine while you await a test result is going to be as short as possible. We won't ever want to delay.
Okay, so as of today, Barbadians can come without
without a test.
And Vincentians can do likewise?
Yes, Vincentians go to Barbados without. We are in what they categorize as low risk, very low risk. And so we can go to Barbados without a test and we will not be quarantined.
Yeah, you think that arrangement might change soon because of what's happening in Barbados right now?
Well, they have stated that it was just a cluster, and that they've continued testing, and I've not heard about any further cases than the 7 that they had. But as with everything, we are constantly looking, listening, if anything changes in terms of what they might do or what we might do, because our situation hasn't changed. There's this thing happened, so we are more looking at them and everybody else.
Okay, so as we wind down, the way forward, managing COVID, managing dengue.
I think for dengue, Simone, it still remains community and social participation has to be key, and we really want that to go. That's why I call it sustainable community participation. It needs to go beyond dengue, and it goes to be setting health priorities, setting health interventions, and so forth. So that is going to be the key thing. Of course, the Ministry of Health has a responsibility for some control, the fogging, the inspections, and so forth, and the technical direction in terms of choices of what to use, what not to use. But social involvement is going to be the key thing for us as we go forward.
And for me, it would be the clinical care in terms of we're encouraging persons early, check with your doctor early, maintain your fluids, do not use ibuprofen or Voltaren, listen to the recommendations. It's better to be safe than sorry. If you have any doubt, go to the A&E, go to Modern Medical, go to the polyclinics, seek health care early. And that is important both for COVID and for dengue. Right now we're focusing a lot on the dengue, and that's what we want persons to do. There's a range, there's the primary health care, there's the secondary health care. The prevention is still better than the cure.
Well, thank you very much, Drs. Simone, Keizer, Beache, and Roger Duncan. That's our program for today. Thank you for joining us. See you again next week, Wednesday. Good evening.